North Carolina is now reporting 4,000 cases in the state. Now here's a look at our area. In the last hour, Mecklenburg County reported 933 residents have tested positive, including 12 deaths. The state as a whole is reporting 80 deaths, up 6 from yesterday. The state has completed more than 60,000 total tests. South Carolina is also reporting 80 deaths in the state. There are over 3,200 cases, including 127 in York County.
Some Amazon workers and their families are worried after getting a message that 2 more workers at its Tuckasegee Road location tested positive for coronavirus. We also know of at least 2 other Amazon facilities in Charlotte with cases. Channel 9's Aaron Edwards joins us live now with the company's response. Aaron.
Genevieve, we've heard from several employees who say they're worried to go to work, but they also don't want to lose their jobs. They received a voicemail from the general manager of this location saying 2 more employees here did test positive for the coronavirus. These cases are the 2nd and 3rd at the CLT4 distribution center on Tuckasegee Road. We've told you about 2 other Amazon locations that have confirmed COVID-19 cases. The Amazon sorting center called CLT5 in Concord on Dorita Road has a confirmed case. And the CLT2 fulfillment center on Old Dowd Road also has an employee who tested positive. Channel 9 received the voicemail sent to employees notifying them of the 2 new cases at this facility. The voicemail says the company is in constant contact with those 3 team members and they are receiving medical care and getting better.
We have reviewed each of these associates' last few days on site in detail, and we are following the CDC's guidance to separately inform any coworkers who may have been in close contact with them.
That voicemail goes on to say that this location has been cleaning more frequently, as well as screening employees for fevers and distributing masks. I reached out to Amazon after hearing viewers' concerns, and Amazon sent us a statement saying they are supporting the individuals who tested positive, and they implemented new benefits, including an additional $2 per hour. Genevieve.
And of course, this all comes as more people are ordering online. Our Aaron Edwards reporting for us live tonight. Aaron, thank you.
The chief medical officer of a local clinic offering rapid coronavirus testing is responding to Mecklenburg County officials' concerns about that test. Now, Channel 9 told you last night that StarMed Family and Urgent Care is promising a COVID-19 screening that gives results in 5 minutes, but those tests are not FDA approved. The county health director has a couple of concerns. One is the tests may provide false negatives, giving people a false sense of security. The other, a test may show a positive result, but it may be for a different strain of coronavirus. In a statement today, StarMed's chief medical officer says the county is not wrong in its concerns. If clinics do this test without proper education and correct processes, there is inherent risk of giving individuals false assurance and making the spread worse. However, he says, quote, that is not us. We do have the processes in place for testing and patient education. He also said that StarMed's testing location on Tuckasegee Road is in an underserved area where there aren't many other testing options. Right now, the state is not accepting these tests because, again, they are not FDA approved.
And tonight we're learning more about a medical group that's closing its offices and laying off workers during this ongoing pandemic. We told you about Halston Medical Group last night, but we were still working to learn more about the specifics. Today we've learned that the group closed 10 locations. The group says 35 doctors were already planning to resign in September. Since elective doctor visits are down, Halston dismissed those doctors early and laid off support staff as well. In a letter to patients, the company said these 3 locations in Mooresville and Huntersville will remain open. If your doctor is no longer with the practice, you're going to get a notification in the mail within the next week or so.
You may have heard that one way to stop the spread of COVID-19 is to achieve herd immunity. Now, what that means is that enough people in a community contract the disease, build up a natural immunity to it with antibodies in their blood, or they get vaccinated for the disease. Now, public health officials think we have a long way to go to get there. The threshold for achieving herd immunity with any infection varies. For example, with measles, more than 90% of the population had to be immune to make person-to-person transmission extremely unlikely. For COVID-19, health experts think the threshold is between 50 and 66%. This means more than half of the country would have to contract the disease or get vaccinated before we reach herd immunity. But reinfections could change this estimate. According to a study by disease experts, some of the hardest hit countries are still far below the threshold. In Italy, only 9% of the country has been infected. In Spain, 15% are infected. Now, health experts say reaching herd immunity would take a lot of time and cost a lot of lives. So many believe a vaccine is the only true way to stop this virus.